Today, Nigeria records more COVID-19 cases. Latest figures from the NCDC now put at 25,133. Health experts call attention to other infectious diseases, especially worry on placement of COVID-19 over high mortality rate of other common diseases. And the EU lists 14 countries whose citizens are deemed safe to be let in from the 1st of July, despite the pandemic. US, Brazil and China excluded. Nigeria continues to see a rise in COVID-19 cases, with 566 new cases announced yesterday by the Nigeria Center for Disease Control, NCDC. Total active cases in the country stands at 15,158, and 9,402 patients have been discharged. The number of COVID-19 deaths in the country has risen to 573, as 8 deaths were recorded in 24 hours. Lagos has recorded the highest number of deaths, put at 127, followed by Kano 51, Rivers 38, Edo 36. Taraba and Kogi have recorded 0 deaths since the outbreak. Of the 566 new cases recorded in 19 states and the Federal Capital Territory, Lagos has 166, Oyo 66, Delta 53, Ebonyi 43, Plateau 34, Ondo 32, the FCT 26, Ogun 25, Edo 24, Imo 15, Bayelsa 13, Benue 12, Gombe, Kano, Kaduna 11 each, Osun 8, Nasarawa 7, Borno 5, and 2 each in Katsina and Anambra State. The states with the highest cases in each of these 6 zones are Lagos in the southwest with 10,310 cases, the FCT in the north central with 1,818, Kano in the northwest with 1,211 cases. River State still tops in the south-south with 1,056 cases. Gombe overtakes Borno in the northeast with 503 cases, while Ebonyi leads in the southeast with 438 cases. The Ogun State government says it has 31 patients from its discharged 31 patients from its isolation centers, bringing the total number of patients discharged so far in the state to 570. However, 25 new cases were confirmed by health authorities in the state as part of the total 807 confirmed cases so far in the state. Out of this figure, a total of 18 related deaths were recorded, while the state currently has 219 active cases being managed in its treatment and isolation centers across the state. The state government has, however, emphasized the need to stay safe, while directives on the use of face masks, maintenance of social distancing, personal and public hygiene remain in force. The extension of the second phase of the lockdown ease begins today after Nigeria's President Muhammadu Buhari approved the extension by another 4 weeks from today, 30th of June, through till Monday, July the 27th. The chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, made the announcement at the daily news briefing of the Presidential Task Force on COVID-19 in the nation's capital, Abuja, yesterday. However, the extension has some modifications to the ease of lockdown protocols, which includes maintaining the current phase of the national response for another 4 weeks, permission of movement across state borders only outside curfew hours with effect from the 1st of July, enforcement of laws around non-pharmaceutical interventions by states, in particular the use of face masks in public places and others, the safe reopening of schools to allow students in graduating classes resume in person in preparation for examination. Now joining us is Dr. Miriam Oshodi, a public health physician, to dissect some of the modifications to the phase 2 of the ease lockdown. She joins us here in Lagos. Welcome, Dr. Oshodi.
Thank you. Good afternoon.
All right, let's start with the precision lockdown. The SGF was talking about it, saying that they will target 60% of those of the contributors of the infection spread in the 18 local governments out of the 774. And he even touted that there might be a total lockdown in those local government areas. Do you think this will help?
Let's take, for instance, Lagos State. Lagos State has about 10 of its local governments being part of the highlights for the next phase of the lockdown. Now, the thing is, we have to ask ourselves a question. Even when we didn't have the local governments being locked down. People still, it was very hard for people to contain, follow instructions, use face masks and all that. And then the local governments are all interwoven. If you're going to, for instance, let's take Koshofe is one of them. If you're going to lock down Koshofe, and then people from Ikorodu local government will not be able to cross over, you understand? And then when they leave Koshofe, Mushin is also one of them. You leave, let's say, the other, Shomolu is not one of them. So you leave Shomolu, and then you skip, and then how feasible is that? You understand? Are we going to see people are still going to be, like, human beings are very versatile. You can't really keep them in one place. So it's practically like all on on. We have half of the local governments in Lagos that are really involved, and then the numbers are really going up, and the deaths are also increasing.
So you think that will be difficult, the collecting of samples and then the total lockdown. But let's also look at what Lagos State is saying. The Commissioner for Health said that we have over 2,000 COVID-19 positive patients who are self-isolating in their homes. Some is for preference, some is for the fear of the stigma, and for others, he says, it's ignorance.
Well, most of our isolation centers are actually filled at the moment. And so people that are asymptomatic, that they have very mild symptoms, are doing well at home. They're just being monitored, called regularly from time to time and all. And then even with the numbers that we have every day, isolation centers can't take all of them in whole. You understand? So that's why it's still, and also Lagos State government is planning the home-based care, which is in pipeline, should kick up anytime soon. But the thing is, we can't even take everybody into the isolation centers. And even imagine having people at home, positive patients, asymptomatic, mild, and then we still want to do the lockdown with local government. See, it all doesn't really tally. So it's better we just have it a whole on.
Another question maybe some parents are asking is, for the schools, students preparing for their final examinations, how many parents are comfortable to allow their children go out, and will there be any option for them?
Now, the thing is, we need to adapt to this new normal. Now, having children in primary 6, junior secondary school 3, senior secondary school 3, go out, because yes, we know that they need to move on with the exams and all, but we still need to work out modalities, because these children, we're also putting them at risk. They're not, they're also vulnerable. They're not out of the age group that can be infected. So we need to revisit that. It's not even that, even people in tertiary institutions are maybe about to graduate and all that, everybody is affected. But saying schools, you know how people, they don't even follow rules. It starts with primary 6, the old school is open from even basic, even kindergarten, they open and then they run the old school all through.
So finally, as a public health physician, what would you recommend in the middle of this revised lockdown, the extension? What would you say should work for us?
Yeah, we are about getting to our peak. We're almost at our peak. That's why we're still having an increase in number of cases. But what I would recommend is the first of all, we need to still go back to our drawing table. We are still we are still having increase in number. And so we still need to, having a second lockdown might not be the best idea, but if we get to that stage, I think we might have to revisit, because shutting down local governments, shutting down some and leaving some is not really going to help.
We'd like to thank you, Dr. Mariam Mushori, a public health physician. Thank you for joining us on the program. The coronavirus pandemic has thrown up a lot of issues as countries grapple with curtailing the spread. In Nigeria, the decisions of the northern governors saw Almajiri children being repatriated to their states of origin, some isolated and undergoing treatment. With the situation surrounding the children, this has necessitated an integration of repatriated Almajiri by the Yobe state government to conduct awareness program for the parents across the state in order to enroll their wards into the Western education. According to the Commissioner of Basic and Secondary Education, Mr. Mohammed Idris, the government will not fold its arms while the lives of the young repatriated children are put in jeopardy.
What we are trying to do is to dualize our curriculum, give confidence to the parents in what we are doing. This will bring about the confidence that is lost in our formal education. It is also not out of place for the government to look at the modus operandi of our Almajiri schools with the aim to bring in a positive boost to it. If you want to change people's mind, you need to sit with them. You need to play to them, the life of the Almajiri. outside the school and how they are being exploited. I'm sure no sane parent will still want to adopt such life for his child. But without a roundtable meeting, without any effort being made by the government to educate the parents about, the welfare of their children that is put to dust, without that, people will begin to misperceive you. They will begin to look at you as inimical to what they believe in. They begin to look at you as someone who is actually not ready to partner with them to make their children acquire the knowledge of what they think is what they will be asked on the day of resurrection.
Over in Bauchi State, the government says that it has spent not less than 15 million naira every week to fight the coronavirus pandemic in the state. The state governor, Mr. Bala Mohammed, gave the breakdown in the state capital, explaining the payment is in allowances for contact tracing and surveillance, case management, risk communication, logistics and supply, and infection prevention and control.
We as a government will continue to shoulder the responsibility of paying various categories of our health personnel involved in the fight against COVID. My government pays more than 15 million every week in allowance for contact tracing and surveillance, case management, risk communication, logistics and supply, as well as infection prevention and coordination teams. In addition, we also ensure that all COVID-19 patients in Bauchi are on a stable diet with 3 meals daily. This explains why our rate of recovery and discharge are almost the best in the country.
Since the outbreak of COVID-19 pandemic, little campaigns are being made to promote other services and health institutions, which experts says could overwhelm the nation if urgent steps are not taken. The Cross River State government says while the pandemic rages on, the country must not neglect creating more awareness on other diseases rather than concentrating solely on the COVID-19 pandemic. The Director General of the state's Primary Healthcare Development Agency stated this in a workshop organized for representatives of different media houses on effective ways of reporting infectious diseases.
There's been a lot of focus on COVID-19, and we tend to forget that there are other common childhood diseases and other common diseases in our community that are ravaging our lives. Malaria, for instance, is killing more people than even COVID-19. We also have maternal mortality, several other disease conditions that are taking lives daily. And there seems to be a shift of attention from such diseases. And so we've realized that if we don't refocus our attention, we might end up losing more people than we think in Nigeria. And so for Cross River State Primary Healthcare Development Agency, we felt it's high time for us to start creating awareness about other common illnesses, and one of such is measles. We have gathered the different media houses here to leverage on their platform to reach out to as many people as possible, especially in all the hard-to-reach areas where we can create that awareness on the importance of immunization.
We have more on the COVID-19 updates when we return. Stay with us. Only last week in Enugu State, the number of health workers that contracted COVID-19 rose to 72. This was confirmed by the Enugu State Ministry of Health in an update on the fight against the virus in the state. Since then, the state now has a total of 261 confirmed cases of COVID-19, with 192 patients still on treatment, 63 persons have been treated and discharged, and 6 deaths recorded. The Commissioner for Health in Enugu State, Dr. Ikechukwu Obi, joins us via Skype on the state's response to flattening the curve. Dr. Ikechukwu Obi, welcome to the program. Let's begin with the 72 health workers contracting COVID-19. Has that number increased, and what happened?
Essentially, what is happening is that we're keeping our records in the Enugu State response for COVID-19, and actually, the numbers for healthcare worker infections have increased. But let me clarify. The healthcare workers we are speaking of are the healthcare workers that are working in some of our public facilities, and private hospitals also. And they are not necessarily the health workers at the front line that are attending to the COVID-19 patients. So a lot of the health worker infections we have reported are people who happen to be health workers in the peripheral care facilities who have also come down with the COVID-19. We are reporting this just to allow people to understand how serious this condition is, and to also buttress the fact that nobody is actually free from possible COVID-19 infections. And incidentally, I just want to point out that despite the training that we have done on infection prevention and control, the information and support that has been provided on COVID-19, you know, COVID-19 is what it is. If we listen to all the other media, even in the other developed world, health sector strategies around the world are being overwhelmed, and healthcare workers are getting infected. So it will be surprising for anyone to think that Nigeria will be different in this matter. But I
So,
want to state categorically that the frontline healthcare workers, we haven't gotten any reported case amongst our frontline healthcare workers that are engaging with the COVID-19 cases yet.
so when you say healthcare workers are infected, what is the number as at today?
As of today, our healthcare worker infection rate we have 83.
How much more is the state government putting in place to protecting frontline workers, and not just them, all health workers in Enugu State?
The healthcare workers under the employ of the Enugu State government, the government has put in a lot. For example, when it comes to the welfare of the health workers, the healthcare workers are on a group life insurance that has been set up for the healthcare workers in the states. And when you further on welfare, I can tell you that the healthcare workers in the state have continued to receive their salaries on a steady basis. And then the state government even put in a 25% increase in the basic salary of healthcare workers and emergency care workers in Enugu. Personal protective equipment has been supplied continually by the state government to the isolation and treatment centers specifically, and then to other support with PPEs have been provided even to peripheral hospitals. The government has sponsored training on infection prevention and control. And then from the State Ministry of Health, we have insisted to the hospitals around that they should put in triage practices in the sense that they should have holding areas and then be able to do a triage of patients to be able to identify possible cases of COVID-19. And we have provided the emergency numbers to all healthcare facilities and healthcare workers so that they will always call the emergency numbers and get to the rapid response team and not have to risk themselves with patients. And for the frontline healthcare workers, they are on a special allowance. They are being housed so that they will not treat these patients and then go home to their families and possible risk infecting their families. And then they are even provided with meals. And this is what we have been doing, as a government, to be able to protect healthcare workers as much as possible. So much is still being planned, and we keep responding to this as it continues to persist.
All right, Dr. B, the extension of the second phase of lockdown is by the federal government. How does this affect Enugu's response to tackling the spread of the virus?
Well, the response is a national one, and then the state governments are also doing their bits, to join in with the national response. So with the extension, we agree with it. It does not really affect our response as a state. We will definitely continue as a state with our efforts at risk communication for prevention so that people will take responsibility and do the right things to reduce the number of infections that we will have. We will continue to identify cases as they come, either by calling on people to come and test when they feel that they have reason to test, and identifying cases by even contact tracing of the cases that we have come across. And then we will continue to isolate and treat the patients that we confirm are COVID-19 positive, and then we will work hard to ensure that they are treated, get better, and following the criteria that has been put forward by the NCDC, discharge them when they are good and fit to go home.
We'd like to thank you, the Commissioner for Health in Ogun State, Dr. Ikechukwu. Thank you so much for joining us on the program. We wish you all the best as your state continues to battle COVID-19. Well, let's take you to Imo State, where our correspondent Itope Kutei brings us an update on how the sporting activities have been greatly impacted by the COVID-19 pandemic.
This is the main bowl of the Dan Ayaun Stadium in Owerri, the home ground of the popular and five-time Nigerian League champions, the Atlant Football Club of Owerri. Before the COVID-19 pandemic, this stadium used to be a hub of sporting activities, aside the known sports that usually takes place here every day. Sportsmen and women in their number visit the stadium to train, keep fit, and for other leisure activities. According to the stadium authorities, this stadium plays host to about 1,000 people every day. But since the pandemic, it's no longer business as usual.
We used to see this place crowded. You see both footballers, lawn tennis players, table tennis players, volleyball players, cricket players, all of them come here to train. But since then, there's been a drastic reduction in the people who come here. You can see the stadium is now empty. People are afraid to get closer to whoever that they train with, fearing that they are afraid of or they're afraid of contacting the disease. So we are saying that a lot should be done.
We're supposed to finish our national festival by now. It's because of this deadly disease that it was cut short and we didn't go again for national festival that's supposed to hold at Edo. So and since then you can see the environment everywhere is dry. There is no training, no athletes, no coaches. So everybody is just in the house.
I don't think that we can continue like this because no person knows when the COVID-19 pandemic will end.
Sports administrators in Imo State and beyond will come together to see how they can revive sporting activities in the country, even amidst this pandemic. From the Dan Ayaun Stadium in Owerri, Itope Kutei for COVID-19 update.
The EU has named 14 countries whose citizens are deemed safe to be allowed from the 1st of July despite the pandemic, but the US, Brazil and China are prohibited. The proposed list of countries include Algeria, Australia, Canada, Georgia, Japan, Montenegro, Morocco, New Zealand, Rwanda, Serbia, South Korea, Thailand, Tunisia, and Uruguay. According to the NCDC, 3 out of every 5 Nigerians who die from COVID-19 are more than 50 years old. Take precautions to protect your older relatives by wearing a face mask in public, practicing the hand respiratory hygiene, maintaining physical distance 2 meters from others. You can visit their website. It has regular updates on the COVID-19 regulations. From the World Health Organization's website, your questions are answered on the coronavirus disease situation. It shows latest global numbers by country on a daily basis. Our website, channelstv.com, has the latest news. All you need to do is log on, access news in health, politics, business, Africa, and around the world, all at your fingertips, channelstv.com. That's a COVID-19 update. Thank you for watching. I'm Millicent Walker. Stay safe.